The last company, but not least, is a company that I've also used, Upstate Concierge. It's kind of a twist on the house call. I'm getting better as I go along, aren't I? All right. So anyway, it's a turnkey telemedicine solution, and basically uses technology like you have in your pocket, your smartphone, and it helps doctors to evaluate on the spot. Without further ado, please welcome Keith Algazine.
All right. Well, I guess since we're closing the house down, I want to make sure we thank all the sponsors, thank all the speakers, thank everyone for having us here tonight. So without further ado, let's get into telemedicine. Well, that's way better, right? Okay. All right, so who can relate? Pink eye, sore throat, a rash, an injury. I think everybody can relate. I want to start out by telling you a little story about somebody who I know can relate. For the sake of this story, we're going to call her Mrs. Migraine. Now, Mrs. Migraine wakes up Monday morning at 7 a.m. She's got a busy week ahead of her. She can't deal with this. You know what she's going to suffer from, right? A headache. But this is no ordinary headache. This is a migraine headache. What are Mrs. Migraine's options in our current healthcare solution? If she doesn't get this migraine treated right away, she's going to end up in the ER. She's going to waste her entire day, spend thousands of dollars. She could go to urgent care, but she doesn't like urgent care. She's going to have to wait. She doesn't know which one is open now. She's going to have to sit next to coughing people and loud people. 2 minutes with a doctor she's never seen or known. It's not a great option for her. Again, she has a doctor at 7 a.m. Monday morning. She's never going to get in on time. It's going to be too late. She could just pull the cover over her head and go to bed. But maybe there's a better option. Imagine if Mrs. Migraine could just click on an app, request a consult, and within minutes be connected to a local emergency medicine and telemedicine expert. Imagine if Mrs. Migraine could have this care 24/7. Imagine if using everyday technology such as phone, video, and text, she could get a diagnosis. Mrs. Migraine could get a prescription sent directly to her pharmacy. On her way to work, pick up that prescription, take it, and by the time she's sitting at her desk Monday morning at 9 a.m., the migraine's already feeling better. Imagine if Mrs. Migraine was so pleased with this service, she was able to sit down first thing in the morning and write a personal note to her HR director and to the CEO of her company, thanking them, in fact praising them for offering and providing this amazing service to them. Well, imagine no more, because Upstate Concierge Medicine is providing this. Mrs. Migraine is a real patient. Thousands of members across the Capital District already have this service, thousands more coming on board, representing nearly 100 companies right now. So, standard problem solution stuff. What's the problem with healthcare? There's a lot of problems with healthcare. But two of the biggest problems, a massive physician shortage leading to inappropriate access to the ERs and urgent cares and hospitals, and of course healthcare costs that are spiraling out of control at an unattainable pace. And if we don't do something, our healthcare system is going to collapse. The solution is Upstate Concierge Medicine. So, quick numbers, telehealth is booming, projected to be a $38.5 billion industry with a market rate is soaring. Again, why is this market growing? It goes back to the problem and solution. The problem of decreased access and the savings that telemedicine can provide. Add to that, millions of members coming on from the Affordable Care Act that don't have primary care doctors and still need care, and it's a recipe for disaster. Now, one more thing that's really driving this market is the drive for consumerism. Everybody knows I can click on an app and have a pizza delivered here in 5 minutes. I can go online and bank securely without a problem. How come if I've got a simple problem like a migraine, or my kid brought home pink eye, I've got to miss a half a day of work, I got to sit in a waiting room for 2 hours, I got to pay tens, maybe hundreds, maybe thousands of dollars for 2 minutes with a doctor for a $4 drug? That's crazy, and we're changing that. So, even the American Medical Association, that's notoriously conservative, estimates that 15% of ER visits and office visits and 37% of urgent care visits could be treated via telemedicine. What's that equal? That's over $300 per visit savings. And if you just took that tiny 15% of ER visits, that little niche market, and you transformed it to telemedicine, you would save over $30 billion for our healthcare industry. And that's just the tip of the iceberg. So, how much does this cost? You can't just talk the talk, you gotta walk the walk. Over $12 for 24/7 access. Our business solutions are just a fraction of that cost. So, who can Upstate Concierge Medicine help? Besides the obvious Mrs. Migraine, we can help everyone. Anybody who delivers care, whether it be hospitals, insurance companies, colleges, businesses, they can all offer Upstate Concierge Medicine. With us as the regional leader, we can help provide those services for these organizations. So again, Upstate Concierge Medicine, taking care of the simple and easy, and then delivering it. Right care, right place, right time. So let's get into a little proposition here for the value. Insurance companies and healthcare practices. Insurance companies arguably have the most skin in the game. Imagine if Mrs. Migraine would have chose to go to the ER. Certainly she would have had to foot some of that bill, but the insurance company would have to fit most of that bill. Imagine if the insurance companies could offer this solution. How much would they save? Healthcare practices, large hospital systems, they can expand their geographic reach without building more brick and mortar and grab patients, treat them simply and easily and conveniently for the simple and easy things, but then drive into their system for the more complicated things. You want more than that? No problem. Put the ER doc virtually at the bedside. Every nursing home patient that's transported is thousands of dollars to the ER and the hospitals. It's all wasted money. However, if they could put the ER doc just sitting at home or in their office and get this information to them, deploy techs, get that information to the doc, keep them in the nursing home. Even more than that, no problem. These techs can do echo, radiology, and again, get it to the doc to keep the patient where they need to be in the nursing home, not in the hospital. Colleges, 24/7, 365, virtual health centers. Right now, college students don't live a normal 8 to 5 schedule, but our health centers are often just like that. So imagine being able to have an own college health center that can be 24/7. I think businesses, Mrs. Migraine speaks for themselves. If you're a business owner, you've got all these healthcare costs, Upstate Concierge Medicine can cut those costs. Again, happy employees, healthy employees. We save money. Why are we so different? It really comes down to local and regional providers providing a higher level of care. That's what it's all about. National companies do have telemedicine practices, but they're doctors all over the country. They're not committed to the patients or the region, and they have a very limited scope, maybe 10, 20 things that they'll treat. That's not going to change healthcare. So, how can you guys help? You know a business who wants to save money on their healthcare costs and provide an amazing benefit, we're here. You know a healthcare system or a practice who wants to transform the delivery of care. If you know a college who would like to transition their college from a regular 8 to 5 to an additional 24/7, we can work with them. And lastly, we're always looking for strategic partners. We're the core providers here. Anybody who can help us provide better, more efficient, higher quality care, we're open to a conversation. So, in closing, Dr. Bibikaus and I lead a team of local and regional emergency medicine and telemedicine experts with national telemedicine experience. The key to that is providers. We're provider-owned and provider-run. You see, because if we're going to change healthcare, it's not going to be through IT folks. It's not going to be through management in the C-suite. It's not going to be through government, for sure. It's going to be when providers take back what was always rightfully theirs, the doctor-patient relationship. And as Rick said, we're bringing that doctor-patient relationship back to the 21st century. We're the modern-day house call. So really, it's simple. What we're asking is, we're emergency medicine trained providers in our region. You already trust us when things are at their worst. You already trust us when your life's on the line. So now we're saying, trust us with your telemedicine care. Trust us to help transform the delivery of healthcare in this region so we can be a beacon of light for the rest of the country. Thank you, guys. Questions? Yes, sir.
I'm not quite sure if I understood the pricing model. So it's $12 per employee per month. Is that on top of insurance? So it's like if one of my employees uses your service, does he still have to do with the proper insurance?
Yeah, so we're unrelated to insurance right now. So we're a separate private pay, $12 per month. Again, we have business solutions that are significantly reduced if their organization pays for it.
It's $12 per month then. That's for how that I'm not sure if I understood correctly. So if somebody gets the app, you just pay $12 per month and you get all these services?
Yep, you get access to a local emergency medicine provider. Your insurance is still critical. A, you need a primary care doctor. Obviously, you need your regular insurance for all those things. But we're just replacing the urgent care, right? How many people run to urgent cares every single day for simple, easy, minor things? They could be treated by a simple phone call, maybe a video conference, maybe text a picture with the doctor. You don't need all of those services that are offered at these places, and that's why it's so expensive.
So this is like $12 a month, up to like a cap, like 3 hours a month, or is it like 24/7 all access?
24/7, 365. Yep. Yes, sir.
I don't understand if one of your doctors prescribes something, how does the reimbursement break? Is there any troubles with insurance companies about having that reimbursed? Is there like a network, or does that not matter?
Nope, that's no problem. That's part of the power of being regional. All our providers already are sort of connected to the local healthcare structure. So just like you walk into a doctor, and if you had pink eye, you would get a script, you'd go to your pharmacy, you use your insurance card, and that would be a copay or a deductible or whatever. It's the same thing with us. We're simply the doctor visit. We're limiting the doctor visit that you have to go to, but you still need your insurance card when you go to the pharmacy or any other service. And yes, we're going to be covered just like any other doctor.
Let's get my head.